Hi, everyone. Welcome to Travelers Week. I'm Kate Ashiel, the Content Marketing Manager at Supplemental Healthcare. And today we are talking about the questions you should ask your travel recruiter. Today I'm joined by Director of Talent Attraction, Alex Acton. So without further ado, I'll just let him get started.
So if you're thinking about becoming a healthcare traveler, you probably have some questions about how to get started or what to look for with an agency or a recruiter. Even if you have some experience traveling, right now with everything that kind of COVID is doing to disrupt the market, crisis rates, uncertainty about what specialties are in demand, a really good partner is important right now to help make sure that you can navigate the market, get what you're looking for, get all your needs met, and really find an assignment that you're going to be happy with, right? That's the key in all of this. We understand that as a healthcare traveler, your job is really hard. It was difficult before all of this, and kind of the current environment over the last 6-8 months has only made it harder. So it's really important that when you think about your job search and polishing a resume, searching for jobs online, scheduling a bunch of calls and interviews, that's a lot. That can get out of hand really quickly. If you've got a good partner to help simplify that process, sweat a lot of the details for you, it's really liberating to help you get what you need out of an assignment, plan your career a little bit better, be a lot happier with the job that you end up with, and most importantly, right now, give you the freedom to focus on caring for patients, because that's really what you're in the job of. To give you a little bit better understanding of kind of the partnership with a recruiter, I think it's good to talk a little bit about what the job of a recruiter really is first. They review resumes, they review job applications, they obviously conduct interviews and check references, that sort of stuff. They also generate submissions to clients, which means that they package up your information and submit it to a hiring manager in a way that will help get you hired, right? Will help put the right information in front of the right person to get you the job. While they're placing new clinicians on assignment, they're also working with everybody else who's working with them, all the clinicians they have on assignment now, to find what's next, right? And plan out kind of the next moves in the career plan. A recruiter really understands all the different hats that healthcare professionals wear, how demanding your job is, because they, as a healthcare recruiter, also wear a lot of hats. They work with people like you every day to kind of negotiate getting started, going through an assignment, figuring out what's next, and really planning out each one of those stages so that it's a long-term partnership and not just a transactional one and done, found an assignment type deal. There are a lot of benefits to partnering with a good recruiter. Really top-notch recruiters have established themselves as a partner for big hospitals and health systems, healthcare facilities like home health agencies and correctional facilities, even school districts. Once a recruiter gets specialized, which a lot of companies like Supplemental Healthcare have a lot of specialization in different settings, sites of care. For nurses, maybe it's the specific specialty, ICU versus ER versus psych. The recruiter gets to know that discipline, that specialty, that site of care, the seasonality, what the demand is like, kind of inside and out. And there's a lot of context that they can help provide on what expectations should be, what's available in the market, what cities and states might be really good hotspots, where you might be able to find the best rate versus the best cost of living. They can really be a partner and an expert in that. They can also help provide you with, honestly, better and faster options for the assignments that you're looking for. Usually their partnerships with facilities means that even for how quickly a lot of roles can turn over and how fast-paced kind of the travel healthcare industry is, they've got access to opportunities that aren't on job boards yet. They may not be on websites yet. A lot of times these things pop up in systems, and with a good recruiter, you can be first in line for that without having to wait to go apply to it somewhere, right? The recruiter can really be proactive in helping to get you in the right place at the right time. The other important part is with those partnerships, a recruiter understands what the clients are looking for, what kind of their perfect match is, so that as the recruiter gets to know your experience, your needs and wants, they can create that match, right? So that both the client is really satisfied with you as an employee and you're getting the perfect assignment for what you're after. There's a lot more to being satisfied in a job beyond being qualified, what's written in the job description. And really the only way to get that information is to work with the facility, to have had clinicians there in the past, to get feedback from hiring managers on what's right and what's not, how fast of a pace it is, what's the floor like, what's the environment in that school, whatever that situation is. So really getting that insight can help make sure that you're happy, the client's happy, everything works out for a really successful assignment. And if a position that sounded attractive, once you find out a little bit more about it, it's not going to be the right fit, a good recruiter can also go back to positions that you may not have seen yet or may have kind of overlooked because you didn't know it was exactly the right pace, it was in exactly the right city, whatever it is that you're looking for, it was a fit that you just didn't know about yet. As you get that relationship with the recruiter, you really develop, you're going to find that they should be as equally invested in your success as you are, right? They're more than just a go-between between you and the facility. They're really dedicated to helping you achieve your long-term career goals, right? Or if you've got dream assignment, locations or a certain hospital or other facility you want to work at, them staying on the lookout for those opportunities for you, that's really the job of the recruiter, right? Is to find the right thing for you in this stage of your career. And then remember that the goal of your relationship with your recruiter is to make sure that you're getting what you need and that you're set up for success, right? In every assignment, right? One good assignment after another. That's really the goal here. So what does it mean to be a traveler and what are some of the benefits? You've probably done a lot of research before you even start talking to a recruiter. That's kind of the way that we all operate nowadays. But don't miss this as an opportunity to really get an expert's opinion on the subject of travel jobs. They can help you understand the logistics, the benefits of a career. How does housing work? How does licensing work? How does pay work? Travel has changed in the era of COVID-19. It's not impossible. In a lot of cases, it's not even necessarily more difficult. It's just different, right? There's just certain things you want to be aware of, be more deliberate about. So you want to weigh all of those benefits and the risks as you go into it. Maybe you don't want to fly right now. You want to be able to drive to the assignment. You want to know what's going on in that local facility or in that city that you're thinking about traveling to. A good recruiter can help you guide you through that whole process to really find what's right for you. Maybe you don't want to travel to the next state over. You want to stay within your own state. Whatever the right fit is, a traveler can help negotiate all of that kind of in the market as it is. And of course, weigh in as an expert because they should have clinicians already on assignment, right, who are living and breathing this. So especially if it's your first travel assignment that you're interested in, they can kind of tell you what the facts on the ground are, how this is really impacting people, some things you maybe want to keep in mind before you start so that, again, you have the best experience possible. Another question that we hear is how many years of experience do I need to be a traveler? What about, licenses and certifications? So there's a number of basic requirements that you'll need to meet to become a traveler, but that's going to depend on your skill set, the site of care, the state, different things in different places. So work with your recruiter to understand what you need. It's really important, especially if you're thinking about travel for the first time, before you start getting in the weeds on assignments, make sure that you've got the right experience for your skill set, kind of the site of care, maybe the state that you're looking for. Some skill sets can travel right after college. Some, for travel nursing, for instance, you need usually 2 years of experience before traveling. So you really want to understand based on where it is that you're trying to go. Are you ready? Certifications, different state requirements, in some cases, charting experience, all of that's going to come down to the specific facility, the state, the agency you're working with. So make sure you understand that. Having the right experience, having your compliance done, your documentation all in place is going to make your whole experience of getting onto the assignment so much simpler and easier. The good news is that traveling is becoming easier all the time with the licensure compacts. For nursing, the Enhanced Nursing Licensure Compact, or the ENLC, has made travel nursing extremely easy for a lot of folks. It's much more accessible now. For RNs and LVNs, LPNs, you can basically have one license and travel between multiple participating states. The list of states that are a part of the ENLC is updated all the time. There's new states being added usually every couple of months. Now the same thing is true for PTs, for physical therapists. There's a PT compact that covers physical therapists and physical therapy assistants. Again, new states being added to that every year. There's rumors of an OT compact that might be in the works as soon as 2024. Other healthcare professionals without access to a compact like that, States may require different licensing to travel. You may even have to apply in every state that you want to travel to. The good news is traveling is becoming more and more common, and so we really hope to see those kinds of improvements like the compacts that help with mobility and make it a lot easier on the clinicians who want to try that. Although COVID has provided us some new challenges, it's also opened some interesting doors in terms of emergency licensing, which has helped a lot of clinicians travel to a new state on kind of an expedited licensing path to get in and start working right away where they're needed most. We really hope that that helps lead to some more permanent changes in the way that licensing works to make it easier for people to move kind of as demand moves and opportunity moves and communities need them in different places. Some states and facilities will even accept nurses and therapists when their state license is pending. Again, highly dependent on the facility and the state. That's really going to depend on your situation. So with all of this, just make sure that you're talking to your recruiter about the specifics so that you know your options and what you're going to need to do to go after that dream location. Another question we hear is, what benefits do travelers receive? It's definitely a good idea to decide what's important to you as far as benefits go, and then ask about that information from your recruiter. So that's healthcare benefits, that's 401k, that's PTO, that's CEUs, continuing education, if there's rewards programs, referral programs, all that sort of stuff. A recruiter ought to be able to tell you about what their company offers and then how that breaks down, because based on what you elect, depending on how much healthcare you're looking at or what you want to do from a this benefit or that benefit perspective, you have a pay package and all of the pieces that go into that benefits package and your exact pay rate and bonuses in some cases and all that sort of stuff fit together in your entire package. A recruiter can help build that package that's really right for you. It's more than just a single rate, and then help you understand how that all comes together for an assignment to be the right fit for you. There's usually also some additional perks for travelers, rewards programs, referral programs. So you want to make sure you ask about what else that company offers. Supplemental Healthcare does Verizon discounts. There's a long list of options and things out there. Especially during kind of these uncertain times, you really want to find out from your recruiter what their COVID plans are. So do they have mental health resources that are available to clinicians? What are their quarantine policies if there's an exposure? What practices do they have in place to protect their healthcare professionals during COVID-19? Make sure to discuss all of that, get those concerns out of the way early so that you know you've got a good partner for the rest of your assignment. There are other factors that could affect your pay package. So depending on what you're looking for, you can make more money maybe in certain areas based on usually the demand and the cost of living in that location. Sometimes if you're open to working in a less sought after location though, I mean, maybe that means it's rural, it could just be a certain state. A lot of times you can find, if you look for it, higher paying positions in lower cost of living locations, right? So it really works out well for the clinician in those places. Right now, also considering crisis rates, which doesn't even mean you're necessarily working on a COVID floor. It could just be high demand at a facility and they're having trouble getting people in. All of that's going to roll into how exactly that you're paid. So be sure to discuss all those considerations with your recruiter. There's a lot of variables that affect your pay as a traveler. As we just mentioned, what benefits, health benefits or PTO or whatever that you elect, that can change how the specific plan fits together. So your recruiter really can customize a package to fit your needs and then kind of talk you through all of that. Your recruiter can also help you understand your travel stipend. We always recommend that you work with a tax professional when you file your taxes based on your particular circumstances for how to deal with that travel stipend from a tax perspective. But that's an important part of kind of the MLA piece of being on a travel assignment. Some contracts may offer incentives like we just mentioned crisis pay. There might be start bonuses, completion bonuses, all that sort of stuff. You can a lot of times even give yourself an extra boost, income boost, by using a referral program. Supplemental Healthcare Share the Care program will give you up to $1,000 for every referral that goes to work, and there's no cap on referrals. That's an easy way to add a little extra income here and there without a whole lot of extra work. So how long are travel contracts? How do crisis needs work? Travel contracts can vary, kind of depending on the need at the facility or in that location. Sometimes it's a week or two, 4 weeks. 13 weeks is usually kind of the industry standard. In some cases, there's 26 weeks, a little bit longer term. Crisis needs right now can be on the shorter end of that spectrum. It really depends on that kind of contract, the circumstances, what the local environment's going through, what's being projected out. It's always a good idea to get clarification and ask your recruiter about a specific contract to make sure that you know what it is that you're getting into, what you should plan for, how long you plan to be there. Make sure that you ask about guaranteed hours, cancellation policies, especially when it comes to one of those crisis positions. Sometimes there's opportunities to get extensions if you want to stay at a facility longer. Even with some of those crisis positions, we've seen extensions being offered when the COVID rates don't go down or the demand doesn't go down and they need to keep people there. You may ask how long it'll take to get started once you're offered a position. Depending on the need, you might need to move extremely quickly to start an assignment, especially in terms of some of the more recent crisis rates. I mean, we've seen incredibly tight turnarounds on some of those. So you want to make sure when you talk to your agency, when you talk to your recruiter, get as much information as early in that process as possible. Talk about the potential start date from the beginning so that you kind of know here's your time frame. You're going to have to figure out logistics like travel arrangements. You're going to figure out housing. So again, a recruiter can help with all of that, but you want to make sure that you minimize that stress level getting into the assignment. So when you're on assignment, you can just do the work, right? And not have to worry about, how am I going to get there? How's that housing going to work once I'm there? All that sort of stuff should just be settled. Sometimes there can be a lot of paperwork leading up to it, which may mean that, it could take weeks in some cases to get into certain facilities. In other situations, you're going to have a much tighter turnaround. I mean, days in some cases. Either way, know what that compliance goal is from the beginning. As we talked about earlier, know what the licensing requirements and certifications, all that sort of stuff. Have your documentation ready so that when it's time to get started, you know what that start date is. Everything is taken care of way in advance and you're good to go. Sometimes you'll have to do some additional certifications or training or an orientation, that sort of stuff. That's really going to vary by facility. So, knowing what's expected at each facility is going to help you kind of plan that into your travel schedule and do you need to be there a little early for an orientation, that sort of stuff. As always, the key, open communication, talk to your recruiter, discuss all of that stuff, keep those lines of communication going back and forth so that you can stay on top of everything and there's no delays. So what happens when you complete the assignment? It's really never too early to start thinking about what's next. A recruiter should be your career advocate, right? Not just transactional, get you in one assignment and be done. They should understand your desired locations. If you've got a list of places that you want to go, facilities you want to work at, big city, you want to go to the beach, you want to go in the mountains, any of those kinds of drivers, let your recruiter know that so they can be on the lookout. They can help plan out what's next for you. You don't want to get caught short and not be able to find the right fit. So again, having all that stuff on the table really helps line up that next assignment, take the break if you need it, go right into the next assignment if that's what you're looking for. Always communicating those goals and plans for what you're looking for. You have vacations planned and coming up. Getting that stuff on the radar will help make sure that all the logistics kind of break down in a way that gives you the best experience. Once you're on an assignment, you have the option sometimes to extend. So should you extend? In general, extending your assignment has to make sense for you. If you're wanting to stay in a certain location longer, if you really enjoy working at a particular facility or being in a certain city, a lot of times your recruiter can work with you on the options for extending or staying in that same general vicinity. It's really important to keep that dialogue open so that they know whether you want to remain or whether you want to go somewhere else, and they can kind of help line all that up for you. Especially with the pandemic in mind, this is a real consideration for travelers right now, especially with certain disciplines where we're finding it a little bit harder to find travel contracts. The order volume just isn't there. The demand's not as high as it was a year ago. It's really important to stay on the lookout early on for those desired locations and settings. If you want an extension, it's really important to talk about that early so that there's no miscommunication. You can get that. You want to make sure to just discuss all those options so that you got a game plan with all the uncertainty in the market right now. At the end of the day, you want to choose a company, you want to choose an agency, travel agency, and you want to choose a recruiter that's going to be your career advocate, right? Partnering with an agency really puts somebody in your corner when you're traveling so that you've got support. That's kind of what the whole thing is about. There's guidance there from a recruiting team, from compliance, from licensing experts, from housing support, all that sort of stuff, so that you can get started in an assignment. You find the right assignment, the right fit, the right location, the right employer, all that sort of stuff. And then most importantly, help you prepare for what's next, right? Because again, it's about a career. It's not about just one job. It also takes a lot of talent to find talent, right? So a good recruiter really matters in this whole thing. We at Supplemental Healthcare are very privileged to work with some exceptional recruiters. We've been named Best of Staffing by a third party, clearly rated, for multiple years in a row. That basically means that most of our healthcare professionals who work on assignments with us across the country say that they would recommend us to a friend. That's kind of the highest compliment in the world. And our customer service scores, the way that they say we support them, really put us up there with the likes of Apple, Costco, some of the most loved brands in America. You only get those kinds of scores because our recruiters are so dedicated to the work that our healthcare professionals do every day, and they help literally thousands of people just navigate everything that a healthcare career kind of entails. So if you out there watching this would like your own professional advocate for your career, you want to partner as you kind of navigate what's next, please contact one of our recruiters. Give us a call. We would love to put you in contact with the right partner for you. We've really got an established client base from coast to coast. So we can help you get the contracts that you want: hospitals, correctional facilities, schools, home health. We really run the gamut, and that's why we can offer the kind of options you're looking for. We promise we'll work hard to be your career partner and really provide the experience that you deserve on your next travel assignment. Thank you so much for watching. I hope you have a great rest of your day.